welcome to another insightful episode on what matters to her. As many of you might be aware, the number of dengue cases are on the rise these days in Sri Lanka, causing a concern for pregnant women. So today, we are going to shed light on what truly matters when it comes to dengue fever and the well-being of pregnant mothers in Sri Lanka. And as always, we are very fortunate to have our true luminary in the field of obstetrics and gynecology, none other than the remarkable Dr. Probhodana Ranaweera with us. So without further ado, let's see what question we have for him today. Doctor, considering the prevailing situation in Sri Lanka, what would your advice be to a pregnant mother who has dengue fever?
Yes, Tarka. So now dengue fever and pregnancy is not a good combination. That's number one, right? And because there can be serious complications to the mother as well as for the baby. But fortunately, most of the time it's only dengue fever, because dengue has different categories. We call it dengue fever, dengue hemorrhagic fever, and dengue shock syndrome, right? So majority will have dengue fever, nothing much happens, their platelets drop a little and they have fever and then they recover. Some will proceed to what we call the leaking phase and go into what we call dengue hemorrhagic fever, where there's bleeding problems, and very rarely or then they can have something called the dengue shock syndrome, where there's blood pressure drop, they are leaking all over, and their life is threatened. So the only problem is when somebody is having a pregnancy, the chance of propagation from dengue fever to dengue shock can be fast and quick if we don't manage properly. And also, despite getting the best care, still there's a chance of, because of the changes that the body have during pregnancy, they are more high risk if they get dengue during pregnancy. So number one, like usually nowadays when somebody gets dengue fever or when the dengue antigen is positive, majority of the patients are not admitted. Right? So we try to manage them as outpatient. We look for certain signs and certain investigations. When there is a problem, only we admit. But if somebody is pregnant and if their dengue antigen is positive, they have to be hospitalized because they need more intensive monitoring and care, so that we try to prevent them going into the hemorrhagic fever or dengue hemorrhagic shock, and also detecting it early and treating it properly. So that's the main reason why dengue patients are admitted. And mind you, majority will just stay in the hospital and just have some blood tests and going home, which is a good thing, right? But sometimes people think, okay, why did I stay in the hospital and all that? So that's number one. And also, when you're having fever, it's very important that you need to check for dengue antigen. That's the main thing, because a lot of people will stay at home, don't do the dengue test. When you have fever for one day and it's high fever, following day you need to check for your dengue antigen and also for COVID antigen. If we detect early and if they treat properly, in the majority of the time nothing happens. But important thing is to know that somebody is having that, because, and especially the dengue antigen, if you do it 2-3 days later, it will be negative and it can be missed. So it's important that if somebody is having fever and to check for dengue antigen. It may be just a viral common fever, but still you need to check for dengue antigen and the corona virus antigen. So that's number one. Number two is if somebody's get dengue fever, then we treat the mother, and now in our normal way we actually disregard the baby at that point, because if we do intervention to save the baby, that can have detrimental effect on the mother, especially if we have to do a cesarean section. That can have major issues to the mother. So during the dengue time, we only check whether the baby is alive or not every day. And we don't check whether the baby is doing well or not, because when we try to do it, let's say we do something called CTG. It's a heart rate tracing of the baby. So if you put, and then we call them deceleration, that the baby's heart rate is going down, and it's an immediate indication for delivery. So if we do that and we see that and we get panicky and then we do a cesarean section for a dengue mother, it's very, most of the time, a serious consequence will happen. So what we do is during the dengue time, we just check every day morning whether the baby's heartbeat is there. That's it. We don't check anything else. Once the mother is coming, her platelet levels are going up, or if her, liver enzymes are coming down. Once we call her stable, out of danger only, we look at the baby. So you have to, the patients need to understand that we do not, the only time we would do something is to save the mother's life only. Apart from that, we will not, because we go by the principle mother's life first, then only the baby. So it's important that that is one of the reasons we need them to admit it and closely monitor, and that is all about the mother. And once we are there, the good thing is majority of the time mother and the baby are going to be absolutely fine. There's always a chance of what we call in the more serious consequences, like babies dying inside the tummy, right? When it happens, especially when they go into shock syndrome, right? And sometimes bleeding and uncalled cause the placenta to separate early and can have problem, and also it increases slightly the risk of preterm labor. So apart from that, and I'm trying not to scare the patients with dengue, because majority of the time nothing happens.
Doctor, I have another question. So, there are some pregnant women who are afraid to take any medication during their pregnancy, even common ones like paracetamol. What would your advice be? Should a pregnant woman take paracetamol if they have a fever?
That's a good question, actually. If you have fever, you have to take paracetamol, 2 tablets, because fever is not good for the baby. Any fever, it's just a viral fever, just a fever, even in corona. The problem for the baby is during this fever time is because every time your 1 centigrade goes up, let's say 38 has become 39, baby's heart rate goes by 20. So if the fever is 104, the baby's heart rates are anyway 150, like that. So they will go hit 190, and that can cause them to have heart failure. So the important thing is to get the fever down. Like you take 2 paracetamol, you can do something called T-bit sponging, where you kind of sponge and get the fever down with the lukewarm water, and then you do that and then get the temperature down as quickly as possible. And this doesn't affect the testing, because dengue antigen is test whether the virus is there or not only.
Thank you very much, Doctor, for sharing that invaluable information with us today. And before we conclude, I'd like to remind all our viewers that we have expanded our knowledge sharing platforms to include YouTube as well as Instagram. So make sure to follow us on Instagram and subscribe to our YouTube channel as well for a wide range of medical content on women's health and pregnancy.